Thanks, Sophie. You're watching South East Today. Our top story tonight. Long waits in A&E, patients cared for in corridors. The Royal Sussex is told to make immediate improvements.
Having lost our daughter nearly 4 years ago at that hospital, it's actually quite upsetting to know that there are still problems.
Our health correspondent is in Brighton tonight with his analysis. Welcome to the programme. I'm Natalie Graham. First tonight, the frustrated patients having to wait more than 24 hours in A&E for a hospital bed and being cared for in corridors. The Care Quality Commission has raised fresh concerns about emergency care at the Royal Sussex in Brighton. The Trust says since the inspection, it's opened a new acute medical unit to ease pressures and says progress has also been made in its maternity unit, as Chrissy Reedy now reports.
Today's CQC report into emergency care and maternity services at the Royal Sussex County Hospital highlighted a number of failures. There were new concerns with emergency care, which it re-rated as requires improvement. Patients, it said, were having to wait more than 24 hours for a bed in A&E, with some being cared for in open corridors, leaving no privacy or dignity. The CQC also found that senior leaders did not always take sufficient action during overcrowding, while staff did not always get timely responses to keep people safe.
The extent of overcrowding was quite horrifying, really. It's mentioned that there were 30 trolleys in a temporary escalation area and so packed together that staff couldn't get in to clean the floor.
Maternity care was upgraded from inadequate to requires improvement after inspectors found several improvements. But it added more work was needed to ensure services were fully effective in meeting the needs of women and babies. Baby Abigail died 2 days after she was born at the Royal Sussex Hospital in 2022. An inquest found Abigail's life would have been prolonged had her mother been admitted sooner. Today, Abigail's parents said they were extremely disappointed.
Having read the report, there are things in there that sound really quite concerning, and having lost our daughter nearly 4 years ago at that hospital, it's actually quite upsetting to know that there are still problems, and I just would like to understand what is taking so long.
The CQC report says that they're not using the latest up-to-date evidence-based guidance in maternity services. And to me, that's shocking, and I think that's a major concern that needs to be improved.
The couple are among 9 families whose babies died at hospitals run by the University Hospital Sussex NHS Trust.
Problems that the Trust has got that have been long-standing and prevalent, and nothing's being done about it. So I think it's too little too late for the families.
Today, the Trust said in maternity care we've introduced extra theatre capacity. We are continually talking to families and staff to understand what more we can do. As for emergency care, we are opening a new acute medical unit to help ease pressures, moving patients to other wards at an earlier stage where possible. In both areas, we've made progress, but we are under no illusions about the very real pressures facing the local health system. Chrissy Reedy, BBC South East Today, Brighton.
Well, let's recap some of the findings in that CQC report. The urgency and emergency care services at the Royal Sussex have once again been rated as requiring improvement. But following this latest inspection, maternity services have improved from inadequate to requiring improvement overall. But the Trust has been told more work is needed to ensure it's fully effective in meeting the needs of women and babies. In fact, the effectiveness of the service has been downgraded from outstanding to requiring improvement. Let's cross to Brighton and talk to our health correspondent, Mark. What should patients make of this, Mark?
Well, Natalie, if we look at maternity first, yes, there were these breaches, but it has gone up one level, as you just discussed. But all this needs to be seen in the context of these families in Sussex pushing so hard for an independent review into maternity services at this trust. Now, have things improved in maternity since inspectors went in February? The Trust will tell you they have. Have they improved quickly enough for the families? The families will tell you they haven't. And then if we look at A&E, patients in corridors, patients waiting hours, even days to get moved out, that's not right. But it has to be seen in the context of wider issues. Do those patients need a mental health bed? Do they need social care? Is there even a bed to admit them to? And that's a system problem which is simply highlighted by inspectors in this report in A&E.